Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities, and it's going to be really an amazing experience, and I look forward to you joining me on the jar. And we're live just like that. Hi, Christian. Welcome to the show.
Oh, thank you.
Yeah, so that's a little video we do for the. It's interesting because that's about 14 months old, right before I even had my first interview. Just getting the jar, the van lined up, getting the stickers on at my friend's place, and with all that pre-anticipation voice of why am I doing this? I have no idea.
Yeah.
And here we are, and it's interesting because it did say, it's gonna, I'm gonna run around and find the common thread, and I think I knew that instinctively before when I was doing, when I was in the planning stage. And interestingly, the common thread we talked, Christian, that's been mental health. So started this show to bring people like yourself who are in the, passionately in the space, and trying somehow got in here, and I think this is a space where people are passionate about it. And you're in here, you're doing your part. You got your bone right now. It seems you're gnawing on that bone. And why don't you tell us a little bit about your story? Just a wee bit about yourself, and then what is it that got you into the space? What's that aha thing that you saw that you wanted to kind of get, and where are you at on it?
Sure. So, my about myself. I'm a serial entrepreneur, and really passionate about everything that I do. I get bored with things easily, and so I just find interesting things and then turn them into stuff. so
solving problems.
Yeah, definitely an out of the box thinker. Or I always say I'm not an out of the box thinker. I didn't even know there was a box. So
yeah. Wait a minute. Wait. Actually, there is a big difference there in the mentality of it.
Yeah, there is.
I agree.
I'm one of those rare folks who decided to not go to college and not get trained the traditional way. So did a lot of my learning through the street and through reading books. And man, I read a ton of books, and that's where I learned most of.
That's amazing.
Of what I know. I shouldn't say I read them. I listen to them on 2x speed on Audible. But in the old days, back when you used to have to read things, I would read a lot of books.
Oh man,
yeah. So it's fun. But anyway, I've been in the healthcare space.
Yeah, how'd you get in the space?
So, I mean, it's a bit of a long story, so I'll kind of tell a little bit of it, and whatever's missed, we can maybe talk about it some other time. But when I was a youngster, I got married fairly young and had 4 kids pretty quickly. But my first daughter, she was diagnosed when she was born with NEC, or necrotizing enterocolitis. So basically, her colon was dying, and so she was in the NICU. And they were trying to figure out what was wrong with her, and of course at that time nobody had any idea what caused NEC or what to do about it. And now we all know that it's basically caused by unsanitary conditions in the NICU. But that anyway, long and short is seeing that whole process, being part of the medical space from the inside, seeing what was going on in the hospital, I just realized that there was a lot of disconnects, that there was a lot of need there, that the system wasn't really aligned. It wasn't really working very well. And so I decided to start working at that hospital. I, was an IT guy, self-taught, as was everybody at that particular time. Yes. They were all self-taught. But decided to start working at the hospital in the IT department. Again, inside, I saw how they were trying to connect things together using interoperability and trying to create, the first health exchanges that existed back then. And I saw that there were issues. It didn't feel right. It didn't feel like it was working. So on my own dime, I went down to Los Alamos National Labs and met with the Advanced Computer Research Lab there, and saw the first example of cloud computing. And kind of had an aha moment at that point on how things needed to connect, or kind of what was the underlying philosophy for solving some of these issues in healthcare. And that could take us on a whole nother rabbit trail, but the short version is that it really is about alignment. It can't be one group owns all the data and everybody else attaches to it and, you know, pays for it. It has to be really an individual controlling their own information, their own process, and then facilitating that. And so I patented an idea around how to actually make that happen. And in that process, ended up acquiring through what's called an MSO, or management service organization, a couple of primary care clinics. And I was going to start using them as a laboratory for testing theories and how to make this all work. And then I thought, you know, the first step was electronic medical records. But learned pretty quickly that created as many problems as it solved. In that process, again, skipping ahead a lot, one of my family members, a close personal, you know, family member, was misdiagnosed by a doctor as having bipolar disorder, and she wasn't bipolar. So he had put her on Lamictal, which was just devastating for several years. You know, I would just find her practically catatonic. It was horrible, a horrible situation. And so I started to see this gap in the healthcare space that was solvable in a way that other gaps in healthcare weren't, because mental health was a clear gap, but no one seemed to care. And which was bizarre, because there was a lot of hands in the pot in the interoperability and electronic medical record world, but there was really nobody's hands in the pot, or very few people's hands in the pot in the mental health space. So I thought, hey, this is clearly causing an issue with my family. And from what I've learned, mental health is connected to physical medicine. I mean, it's connected to heart attack, stroke, diabetes, hypertension. I mean, you name it, it's everything. Why is no one solving this problem? And so I started a mental health company back in 2011 that just identified mental health issues, and had some partners and got it all up and running. And through that was able to actually find out that my family member did not have bipolar disorder, which was a huge eye opener.
Goodness.
Yeah. And so we were able to get her off the medicine, and through a long series of events, got her what she needed, and used some genetics in that process to figure out what was wrong. And that's really what turned me on to the space. And then once I got in the space, I realized that if we could solve this problem, it would solve so many other issues. And it would sidestep a lot of the Bravo Sierra around you know, interoperability and you know, records and all the transfer and all the things that people were trying to solve. We could solve those in an easier way by solving this mental health issue. So that's, you know, I kept going down that space, ended up selling that company to a private equity group, and you know, still stayed in love with the space. I just couldn't let it go. I was you know, during Obamacare, they basically cut the reimbursement on our code that we were using by 60%. So it made it really difficult to continue the way we had done it in the past. And so thought maybe it's time for me to just, you know, kind of walk away from all this for a while. But in that process, I couldn't let it go. I mean, I just couldn't stop thinking about it. I meditated for almost a year straight, not contiguously. You know, oh, sorry, I lost my earphones. Hang on one second.
Yeah, I'm still.
Sorry. Can you hear me?
I can hear you.
No, lost my headphones. Hang on a second.
Could be me.
Here, I'll switch. There we go. There we go. Switching to these little critters. Can you hear me okay?
I can still hear you. You can hear me?
Okay. Yep. Sorry. My Bluetooth decided to bomb out on me here.
Sometimes it happens.
Yeah. Anyway, I'll turn that off and throw it down. Okay. So I forgot where I was.
So you were kind of talking about Obamacare, and then it switched. You had to switch
Yeah.
that kind of switches everything around. You got out of that company, or you had already
Mhm.
got out, and just
Yep.
kind of meditating on what to do next.
Yeah, I was meditating, did a lot of walking, did a lot of reading for about a year. I couldn't figure out what to do, and
Yeah.
I just couldn't shake the feeling that this needs to be solved. It wasn't getting solved. Even the company that had built before, it was good, but it was missing a piece, a pretty big piece. And as most things in my life, at least as an entrepreneur, and most entrepreneurs would probably say the same thing, I just kind of like ran headlong into a brick wall and discovered this magic formula, essentially, quite by accident, which was what we used to develop Connected Mind, which is my current venture. And in this venture, really decided to stay very laser focused instead of having my hands in 100 pots and running medical clinics and IT and software and all the different things we were doing all at the same time. And decided to really put the focus strictly on solving the mental health issue in primary care as that handoff into behavioral health. And
Okay.
so we developed Connected Mind to do that. And what it essentially does is it screens for the 6 most common connected mental health conditions simultaneously. It does it in
Okay.
random order. And then based on the responses to those questions, the person's either done taking the test in, under a minute, or it will actually launch into a customized, test specifically for what that person has triggered. And it's random. It responds to the answer, so it adapts to how the person answers. It's kind of like being interviewed by a clinical psychologist. And
Okay.
what's so unique and special about that is 2 things. Number one, we found a way to balance workflow with detail. So in primary care, especially, when I say primary care, by the way, I mean family practice, internal medicine,
Yeah.
OB-GYN, and pediatrics.
Okay.
So
Okay.
that's where everybody goes to be seen by the doctor.
Yeah. Yeah. That's probably 90% of the visits. Whatever the number
Exactly.
is, 80, certainly eighty
Exactly.
percent.
Yeah, exactly. And so, in that space, they are pushed through the chute like cattle. I mean, people are just, in and out 5-10 minutes. I mean, the good ones maybe 15 or 20 minutes, but they don't have a lot of time.
You're not going to get
So,
picked up for it. And there's, I mean, in talking about my mental health, the guys like,
yeah,
checks everything, and it'd be so casual. You wouldn't even feel like it's a real genuine question in a way. Like,
exactly. Like, are
how are
you
you
feeling
doing?
depressed? Yeah, or
Yeah.
how are you doing?
I mean,
Exactly.
that's a friggin' rabbit hole. We only have 15 minutes, but like you just would just, I would even want to say, yeah, I'm fine. I'm okay.
And most people don't, or they'll take a test, a PHQ-9 or a GAD-7, which are the traditional tests that you were given in those clinics. And people looking at those know exactly what it is. Well, this is obviously a depression test, or this is obviously an anxiety test. I don't want to talk about it, so I'm not going to answer the questions. And so our tool was designed to kind of sidestep all of that, but do it in a way where it did not interrupt the workflow, which is what
Okay.
so many products do. Because to do this correctly, it takes a long time. I mean, you have to ask a lot of questions. You got to figure out what's going on with somebody. So
Hmm.
we just figured out how to balance those 2 things. So some people in the 20% of the bell curve are going to take long tests. It's going to take a while. But for the 80% in the middle, 2 to 5 minutes. And if someone's not dealing with something, it's a minute. You're over. You're done. You move on. But for a doctor, that's a big deal, because now they're not prescribing medicine by just asking you a simple question. Do you feel sad? Well, yeah, kind of. Well, here, take this pill. It changes the entire game, you know, and it makes their life better. It's more aligned because the doctor now is able to actually bill insurance for this. And for the doctors that don't bill insurance, it's inexpensive enough that they can just pay for it and be done with it and give it to patients. But it gives them the kind of information they need to really decide what to do with people and where to go. And it's not just focused on depression, anxiety, because mental health's a spectrum. There's a lot going on. Maybe
Yes.
it's
Yeah.
anxiety, maybe it's somatic symptom disorder, which is on the spectrum with anxiety, but doesn't always trigger anxiety. So it's just a good way for these doctors to actually find these problems and do something meaningful with them. And it's not always kick it down the road to the psychiatrist. Sometimes it's just deal with it in house. Sometimes just acknowledging the person's dealing with something.
Yes. I think that's like, I could see a lot of times where it's, do you want to talk? Hey, look, this is what the test kind of came up with, are you ready to talk to somebody?
Absolutely. And I don't know. Sorry, I interrupted.
Yeah, no, I mean, just like it, at least now the doctor's got real concrete information to ask the next question.
Yeah, exactly. Well, and I can't remember if I said this when we went live or before. I think it was before, so I'll go ahead and say it again. You could stop me if I didn't, but 69% of those that get diagnosed with a mental health condition come into the doctor talking only about physical symptoms, meaning they didn't know the symptoms they were dealing with were caused by mental health. So how is a doctor going to
70%?
Yeah, it's insane. And how is a doctor expected to find out what's wrong with somebody if the person doesn't even know themselves?
Everybody's like, you're in a room, you've got nothing but serial liars coming in, right? In a way, they're just lying to you about what they actually is going on. And you have to figure out what the real truth is.
Yeah, I mean, and I know that that's kind of like that with all of medicine, but especially around mental health. I mean, without somebody being able to communicate what's going on, there's just no way of knowing. So that's what our tool effectively does, is it goes in and it finds those problems. So, and then during COVID, we realized that primary care just was not going to be able to cover the spread. So we built a version that's anonymous. It's free on our website. You can go take it. Corporations can use it and get an aggregate view of the mental health so they can make decisions scientifically on what to do with their organization. But we built that version.
That's great.
And the cool thing is it actually converts to a clinical version. So you can take it to your doctor where you're getting the appropriate level of information for an individual. So it's like a gas gauge. Green is good, red is bad. It's really simple to read. If something's going on, it's got big giant red flag says, hey, you need to call this number or go to the ER. But otherwise, you go to your doctor and there's a little code at the bottom. The doctor just types in the code on a website and boom, it converts it to a clinical version, and they've got the information that they need to go take next steps. So
to start the conversation, right? To start,
Yeah.
Very interesting. Yeah. Now, this is interesting because the President Biden signed from the White House into the strategic thing around mental health, and one of them is getting medical providers to integrate this into their care. And I don't, it's not a law. But these are the beginnings of a shaping, what it should be, should be part of the practice. And I know some do, but this seems like your tool is really well positioned for that. I mean, to help make that happen.
It really is. Yeah. The biggest problem in the healthcare space, again, is with alignment. I mean, that's the problem with the whole thing overall. But even with mental health, a lot of times government talks about wanting to make a difference in the space, but then simultaneously on the back end, they cut the reimbursement so a doctor can't get paid to do the work. It's like, what the hell are you guys thinking? Or it's all about looking good and not actually doing something. But there's a group out called the Kennedy Forum. Fantastic. Former Congressman Kennedy runs it, and they're doing a lot of fantastic work around really kind of pushing the legislature in all the different states to start to hold insurance accountable to spending money on mental health. I mean, and there's been multiple lawsuits that have been out recently. There's a fight, but we're winning the fight. So there's the fight for the stigma, like even talking about it, but then there's a fight to get paid, because if doctors are not going to get paid for their time, they're not going to do the work. Period. It's just not going to happen. So.
And, if you're doing the work, comes with it liability, all these other things especially from doctors. It's goofy at the end of the day for hospitals, because you're treating symptoms right now, symptoms of the mental health
Hmm.
crisis that people are, people
Absolutely.
have. If you've got stress, you're going to end up with a heart attack or a
Yeah.
stroke, and then
Yeah.
you're going to end up, you're going to end up on meds and treatment, and the cost of the insurance company is tremendous. So,
Oh,
they could.
it's insane. Yeah.
So, if you could treat, I'm a root cause guy. It seems like if you can get after the root cause, our medical situation would be way, way, way better. The cost, and so I think
Yeah.
it is trying to figure out sometimes maybe even how to move the money, how to move the money from the back end to the front end. And then maybe there's some, now we start getting some goofy human behavior like, whoa, let's not get crazy here. I'm a heart specialist. We don't want to be eliminating heart attacks too soon.
Yeah. Oh no, wouldn't want to do that. Yeah, for
Yeah.
sure.
I mean, you got a drug company going, I just spent $10 million on a heart attack medicine. Let's just slow roll this legislation. But
Yeah.
it's a practical thing, Christian. These are real, like, things we'll have to overcome will
Yeah.
be the treatment. There's a lot of money in treating physical conditions,
Oh,
and
absolutely.
there's an
Absolutely.
industry around it.
Well, and we work with Bail Donine for heart attack, stroke, and diabetes prevention. It's a group. They're super well known for helping to prevent heart attack, strokes, and diabetes. And they use our tool for the psychosocial side of it all.
Oh,
And
okay.
psychosocial is one of the key components to preventing heart attack and stroke, especially secondary events. Because if you have a primary event, heart attack, you're 300% more likely to have a second event if depression is a factor. So it's critical. Psychosocial is critical to all of this stuff. But
300. Yeah, you've got to have
yeah,
you got to find the good space for your mind. Definitely.
absolutely.
I mean, you can feel when you're not right in your head, things are not going good. You can physically feel it. It
Yeah,
would,
and yeah, most people don't know what they're feeling though. They don't know that pressure in their chest, might be anxiety, or they don't know that feeling of fear might be something else. It's
Mhm.
not. They don't understand how to put words around it, and so that's why this kind of stuff is so critical. And really, if we're going to make a real impact here, this has to be driven from people up. I hate saying the patient because the patient is you and me. It's people.
It's everybody. Yeah.
Yeah, and so it's got to be a push from the person through the doctor all the way through the system. And if people just demand these services and won't take no for an answer, that's the only thing that's going to really make an impact. Plus, I mean, people should have the ability. Oh, let me step back, and I'm quoting uh, uh, gosh, I can't remember his name. Forgive me. I forgot his name all of a sudden, but it's the doctor who invented the soap note, basically. And he
Okay.
said, yeah, Larry Weed, his name is Larry Weed. And he basically said that doctors are not oracles of information. They are guidance systems in complex situations. So when doctors act as oracles, that's when people get hurt. They
Yes.
have to act like guidance systems. And that's the only way that this is going to work long term. And in order to be guidance systems, people need to participate in that process. It cannot be, going to the Wizard of Oz and saying, "What is wrong with me?" And then they just magically tell you, because it doesn't work that way. So,
I
sorry.
can't see it. It's a beautiful analogy because you can't see inside somebody's head.
Mhm,
I can see your heart's getting damaged. I can see your blood pressure's, freaking out. I can see maybe
mhm,
even, cancer, right? I mean, it could be cancers. It could be ultimately long term. You could be wrecking your cell structure with the stress could be doing that. So I can't see inside your mind or understand, but I can see the physical side. So,
mhm,
it does make some sense. We're kind of at an
mhm.
evolutionary point, I think, maybe like hearing you. It's like we're in evolutionary, like we're in a conundrum here. We have all these great treatments for all these illnesses, but actually we've just found out recently, it seems, what causes the illness, but we're
Yeah,
still completely embedded in the treatment regime.
yeah, yeah. It's insane how the whole system works. Well, again, it's out of alignment, and
And
without
that's it. I guess it's
alignment,
out of
nothing
alignment.
works.
Yeah,
Yeah,
it's out
I
of
mean,
alignment.
I often use the word integrity, but I don't mean integrity as in honesty. I mean it as in alignment. But
Yeah,
without
yeah,
integrity,
yeah,
nothing works. Yeah.
yeah. Interesting.
So
You were talking when you were talking about the medical records and stuff. And I think I was seeing some of the stuff on your profile. I was thinking of NFTs. Ultimately, being able to put your medical records on your own address and owning your own medical. So an NFT, like a non-fungible token, but basically on the blockchain. I should say a better way of saying
I
is on the
follow.
block.
So, yep.
Yeah, sorry, on the blockchain. In the form, it would be in the form of some kind of an NFT. But beyond the blockchain, and and if you wanted my stuff, I just give you my address, and you can plug it in. You can see it. You've got access to. You got access to all my medical records. You can see the whole files. I mean, it's kind of like a Google Drive, except Google doesn't see it. And the whole point is, right? It's private. And nothing on Google's servers is private, as far as I can tell. So it's you can own it yourself. Nobody else would own it. And if they want to write to it, like a doctor and everything else, they want to write to it, they can write to that file, put on the medical. So it wouldn't be sure the hospital can keep their own records, but you would be required by law to write into my personal record on my block, on my my record on the blockchain on my record. And I think that's the best way. Then everywhere you go, you always have your own. You have the master record. And of course, like I said, hospitals can write whatever they want, but I think anything the hospital writes should, by law, end up on my record. So anywhere I take it, anywhere I can see my history, I would love to know what my history was. I mean, I broke my arm, I had stitches here and there. Those records are all gone. I never even owned them, probably, shockingly.
Yeah, absolutely. I totally agree with you. I mean, it has to be patient owned. I think there's a case to be made for blockchain. I think also there's a case to be made for, being able to access that and have people write to your medical records whenever you go to the doctor. That's kind of what my patent was. Except
that's what I was picking up on the. And for me,
but it uses biometrics to attach everything, and stuff gets stored wherever it was created. It gets stored, but when you use your hand or your veins or whatever, it pulls it all back, and your body is what identifies it as being you. Everything else is completely de-identified. But that's a whole rabbit trail. But it's basically the same kind of concept.
That idea may come, I think you were ahead of time on. You had the right concept, and now I think maybe the blockchain is a place where you can be stored. And however, it could be biometrics where the company uses the hospital or whatever uses that to ultimately upload and write to your medical file. And like I said, and it should be doctor's notes, the nurse's notes when they came in, all that should automatically just be boom, click, straight into your file. And then you've got that as a permanent record, lifelong record.
Absolutely.
And the patient owns that. Not the secret stuff where the doctors and hospitals have all their little secret notes and it's everywhere. And then they could sell your data, probably sell your information, and you should control your own data.
Or the more common scenario, which is they didn't write anything down at all. Remember the story about my daughter? Well, we went back to find out all that information to see what could be done about it. And they didn't write anything down. It was a bunch of chicken scratches. So it's pretty bad.
I would imagine getting somebody off of those kind of meds is a lot harder than it is to get them on them. Like,
you're talking about the Lamictal?
Yeah.
So my daughter was not the one on Lamictal, just because if she ever watches this podcast, she'll be mortified if she thinks I was talking about it.
Not her.
No, it was somebody else. But yes, it was quite difficult. You had to titrate off of it. You had to watch everything. It was not fun.
Yeah. I mean, getting off of them is a lot. Like, once you're on that stuff, you're identified, you're labeled, and it's a danger if you come off of.
Yeah, unfortunately, a lot of those medicines are like that. I mean, even, simple, anxiety medicine or depression medicine, if you quit that stuff cold turkey, it's not good. It creates a lot of problems. It's people, but I don't think people realize how serious that stuff is. It's heavy stuff. So,
and like I said, hopefully we can get better recognition and the right diagnosis. It'd be great if if you do have something that's like what your tool is in the workflow of the doctor-patient relationship, you're getting into that space. Very difficult. I'm sure that was a hard road to get through. And interesting. I like this idea. 20% of people, if you can find 20% of people that should have a conversation, that's impressive. That's a lot of people you're helping.
Yeah, absolutely.
That would have slipped through.
Yeah,
that would have.
Exactly. Would have slipped through the cracks if they hadn't have been found.
Yeah.
So,
how do people find your? How do they find you, or how can they help? Anybody listening that's in the mental health space, is there a way that they can help or get in touch or?
Yeah, absolutely. So, I mean, obviously, you can go to our website, connectedmind.me. Take a screening. There's a whole section there that says help a friend. Send it to your friends. Send it to everybody. Just get screened. We make no money off of it. We can't even tell who took the test. It's totally, completely anonymous. But the more people that use it, the more people get found and the more people get help. So that's the first thing, is that you can get a hold of me that way, or you can find me on LinkedIn with my extremely complex last name here. Look at the name down here.
It's Connected Me, right?
On LinkedIn, connectedmind.me.
Oh, I'm sorry. Say it. Oh, connectedmind.me.
Yeah, just like on my label there.
All right. Let's see how that goes. I did I did a thing. Did it work? No?
What?
I did a banner. Let's see. Oh, show it. Okay, there we go.
There we go. Yes, brilliant. That works.
I'm working. I'm getting better at this little toy.
That's fantastic.
Oh, yep. That's great. So that's a great. I'm going to go there for sure. Right after this, I'm going to take it. Yep. I'm absolutely going to jump on. Let's put that. I'll paste that into when I share it on LinkedIn and Facebook and stuff. Okay. I'll throw it in there as well. Okay. Any kind of closing thoughts? Any messages you want to, any shout outs or any messages you want to close with?
I think the biggest thing is everything starts with identification. So get screened, get your family screened, and do it at least once a quarter. Things change, seasons change, life events, happen. Knowing what's going on with yourself, you're the only one that gets the results. And then if there is an issue, bring it to your doctor and have them take a look, and do not take no for an answer, and do not take this, pardon my way of saying this, the stupid paper test as the solution, because it is not. So,
okay. Yeah. And I think it's great. Be your own advocate. And that's your best. That's kind of that message I got. Be your advocate. And and if you're having trouble and you're having trouble advocating for yourself, make sure you find someone that you can bring along that can help you.
Absolutely.
Getting help shouldn't be too hard. And if you feel like you need help, you should be able to get it.
Absolutely.
Without a lot of trouble, without a lot of fight.
Yep.
Ben, it's awesome, Christian. Thanks so much for being a guest. Thanks for sharing. Really cool space you're in and what you're trying to solve. I think you've got a good product in the right place, and I'm kind of curious to see where if this is version 2. I want to see what version as your mind is going and your unconventional kind of problem solving. The next thing that you got on deck will be interesting, I'm sure.
Yeah. It's called Skynet. I'm just kidding. No. Awesome. Thank you so much.
And hang around for a minute. We'll have a quick chat after. Thanks, everybody.
Yep.